Hi everyone, thank you for joining today's Instagram Live here at Enhanced Fertility. And today we have very special guests. Today we are introducing IVF Turkey. So I will be speaking with Zuhal. Hi Zuhal, I'm going to invite you to join us, and Professor Meric Karacan from IVF Turkey. So technology work. I hope we can. We did it. Hi, Zuhal.
Hi, how are you?
Merhaba, how are you?
Merhaba. Well done, well done.
And I can see that Professor Meric is here. Let me invite him as well to join us.
Please.
Are you okay?
Oh,
Hello.
he looks handsome as always.
Hi, Professor Karakan.
Do you hear me? You hear me?
We
I
can
can hear you. Can you hear me?
Yeah.
Okay, wonderful, wonderful. So I'm happy to meet you over here, over this meeting. So I'm listening to you right now.
Perfect. Professor Karakan, really
Yes.
nice to meet you. I met Zuhal at the fertility show in London.
Okay.
And that's where I got to know IVF Turkey really well.
Okay.
And we love working together. So we thought it would be a great idea to talk a bit about IVF Turkey to everyone on Instagram today.
Okay, wonderful. So wonderful. So I'm happy to have you working with us because we have many patients coming from the UK to visit us in Istanbul, and we were having some difficulty having some scans, ultrasound scans, and some tests. So I'd like to collaborate with you in the future.
So maybe let's start from the beginning. Where is IVF Turkey? You already mentioned Istanbul.
Yes, we are located in the heart of Istanbul, namely Beşiktaş. It's a very accessible place in Istanbul. So it takes almost an hour to get to where we live, where we work, from airport to the center we work in, and we have been working in this field of IVF more than 25 years in Istanbul. So our co-founder or our founder has been working in this field since the establishment of IVF in Istanbul, in Turkey. So I can say that we are one of the most experienced center in Turkey.
And as you mentioned, so it's in Istanbul, so it's very easy to get to from anywhere in Europe. There's flights,
right?
So it's very easy to get to.
Yeah, there are a number of flights from all over the Europe, all cities of Europe to Istanbul. So you can easily reach us. They can easily reach us.
It's in central Istanbul and it's a very nice place. All our patients are also having fun during their treatment.
Yeah, that's right. That's correct.
Yeah, it's a beautiful city. I've been there a couple of times.
Oh, wonderful.
And it's so different from anywhere I had been. It's fascinating and vibrant, and the food is amazing.
It is.
Thank you. So you should come and visit us one day.
Absolutely, absolutely. And Professor Karakan, what kind of treatments can people get at IVF Turkey, or what drives people to go there for treatment?
We have all kinds of assisted reproductive techniques available in our center, same as the most advanced centers in the world. But we mainly perform intracytoplasmic sperm injections in couples seeking treatment for infertility. So almost 99% of our cycles, the IVF cycles, are made of intracytoplasmic sperm injection.
Okay.
And in addition to these conventional techniques, we also offer our patients to perform a pre-implantation genetic diagnosis. And so no need to mention, but we also perform all types of infertility operations, such as hysteroscopic operations and laparoscopic operations. So we have a wide range of service available in Turkey.
And I think the ovarian rejuvenation technique, I think we've had a patient recently.
Yeah,
Right.
Is
Right. So there's been some studies regarding the efficacy or rejuvenation technique of, namely, platelet-rich plasma injection into the ovaries. We have been performing this technique over 1.5 years, in the last 1.5 years, hoping to get some benefit of this technique. So PRP administration has been very popular these days, and we have been doing this administration in women eligible or a good candidate to this technique.
Just before our Instagram live, one of our patients reached Andrea company for the test results, and then you done PRP recently, and we had one MH result, and it was increased again, and so I'm happy with the results too.
Right.
I'll follow all our patients. Thank you, Dr. Meric. By the way.
So we have observed the benefit of this technique in some patients. So I hope in the near future we'll better describe the most eligible candidates to this technique.
And do you find that people who seek treatment at IVF Turkey are people who are getting started, or are people who maybe have struggled for a while? Maybe they've had other treatments that haven't worked. Who is the most common patient that reaches out to you?
So both, actually, right? So we had many patients coming over to Turkey for their first IVF IVF cycle, and as well as some patients who tried several times but failed to achieve pregnancy elsewhere. So we have both types of patients.
It is.
And why do you think it's such a common destination for fertility treatment? What attracts people?
Actually, the location of Istanbul, just in between two continents, is a very attractive center, attractive city, together with the experience, I believe. So I'm not saying that we are the best IVF center in the world. So I'm not saying that, but we have been working in this field for more than 25 years. That implicates a huge, vast amount of experience. So the location of the city and the experience of the centers attract people. That's what I think.
Also, just because doctor sees a lot of patients from all over the world and different ethnic and different problems on the patients, and it just gives us lots of experience. So just also because of the location and the quality of the service. We have a team, and we always follow our patient very closely, because for a while we become a family. They are coming to visit us with their babies, and afterwards they just recommend to other people. And because it's not just the medication treatment, of course, it's the sign. This is the doctor's job, but all our patient coordinators just it's a psychological duration as well. It's struggling. It's not easy journey. So that's
right.
We become a family, like a friends and sister and brother. And then there's also, I think, another factor. And then also the food, I must say.
Yeah, correct.
Yeah.
Correct.
Those are great points. And do you think that also maybe the cost, because I know to have treatment, for example, in the UK or in the US is so expensive. Do you find that cost can be a driver for some people to seek treatment?
Absolutely, right, Zuhal?
Absolutely affordable, I can say, but this is not the first reason. I mean, I don't want to polish this the price factor, but it's obviously very affordable when you compare with the world, with many countries, not just the United Kingdom, also United States is very expensive. And also we don't do like hidden costs. Because sometimes when you do your search online for the cost wise, there are many things they add extra and extra and extra, but we are very sensitive about the cost, and we always inform the patient in advance because they are flying to another country. So just we don't like surprises either. We are trying to be very careful. Of course, we are working with the human body. There might be some, additional condition is the health. The most important thing is the patient's health. But mostly whatever we just quoted, and then this is like very the certain things we are just we can say that is affordable price and affordable cost.
Yeah,
but
correct.
mostly I can say is the quality of the service is the first thing they choose us.
And sometimes I've noticed that people also travel abroad to have treatment that maybe they cannot have in their own countries.
Yes. But actually, we perform conventional IVF and conventional intracytoplasmic sperm injection. We also some limitations in Turkey. For instance, we are not able to do donor egg cycle or donor sperm cycles in Turkey. But in some other standards, rather than limitations, there is a long waiting list of, for instance, in UK.
Yeah.
That's the reason they prefer to carry out IVF cycle, go through IVF cycle in Turkey rather than limitations.
Yeah.
But the timing is very important.
Yeah, this is
I
very
agree.
important. Thank you, doctor. I mean, I forgot to say we don't have a waiting list.
Yeah.
Just it's very, very important. This is one of the biggest problem in the UK, the waiting list for any treatment. And then also just, of course, we are checking all the medical condition, but doctors evaluate everything together. We don't put like such a age limit or the BMI limit, but of course there should be some optimal limits for everything. But they evaluate all the medical results. Then if they see that is eligible, then we invite the patient right away. We don't have a waiting list.
I think that's a very good point because the waiting lists in the UK are very long.
Yeah, I know that. Yeah.
And
It's exhausting for the patients to wait for a long time because as they wait, they get older, and that decreases the chance of fertility and the pregnancy rate significantly.
yeah, I think potentially the fact that in Turkey people cannot do egg donation probably just means that the science of ovarian rejuvenation is advancing faster because that's something that you are more focused on.
Right. Yeah, correct. You are absolutely right. Since we are not, we're not able to offer this service, we are focusing on rejuvenate or boosting function of the ovary if we can. So you're right. You're absolutely right.
And how does it work for patients? Because I imagine for any patient, it can be very difficult to make a decision to go abroad. They may not speak the language. They don't know the streets. They don't know anything. How are they supported throughout this challenging part of their lives?
Yeah, that's why we have a team in the UK, and I'm the UK director of IVF Turkey, and we have a team here for before they go, and that's why actually we have a cooperation with you as well. Every day we are trying to improve our service and make it easy for the patient because they have some concern, they are afraid, and so when we started, and we do some initial checks here, as you know. And then your company also helps us to make it easier, and they don't even have to go to the clinic. And you are sending your kids the blood testing, the hormone testing to their home. And then we will be able to see the patient condition, and our Dr. Meric evaluate their results. And there is additional like some vitamin support or anything can be done, and they advise them before we start the actual IVF treatment. And then we are able to follow them up. And when they started here, that's why we do half and half, because IVF is not a short journey. It's like almost when we start actual IVF treatment, it lasts 20 days. So it's not easy to stay in another country for 20 days sometimes.
Yeah.
And for most people, what we do is we split the treatment half and half. 10 days, that follow-up part, the medication and the follow-up part, we are able to do that. And also with your company and the scan follow-up, we do the monitoring here. And then our doctors will be able to see their scan results. When we see that the patient is ready, they are flying to Turkey to complete the operational part with our lovely Professor Meric in Turkey, or with other doctors as well. And so that's why, as you see, we have a team. We speak many languages in our team in Turkey as well. Our patient coordinators welcomes there when they arrive Turkey. We also have an accommodation and also transfer service. They welcome them. They take them from the airport to their flat or the hotel, whatever they choose, with the package deal, and we are able to give them the medication in the UK and Turkey as well. And so just, it's very easy. They just need to book their flight ticket. That's
the reason, shortly.
And I imagine if they want to reach out, they can have an initial consultation remotely as well.
Correct. Yeah, they can have initial consultation if they send us their data with the details. So we can easily consult. We can easily tell our opinion on the future treatment. So it can easily be done.
Yeah, we have a system medical questionnaire link, and then we directly send the patient. And those are 4 questions for fertility and what the doctor needs to know. After they filled up, we are evaluating and making a survey for our doctors and all our patient coordinators, because they reach us. Firstly, they reach our patient coordinators to ask their question, to get some brief information, and also the medical questionnaire, and then we guide them for their fertility journey.
That sounds great. And where are most of those patients coming from?
Where?
Yeah, the countries in Europe.
I would say United Kingdom.
Yeah.
To be honest,
I would say, I agree with you. So United Kingdom would be the number one, and United States, many patients from United States, and then all over the world, some other parts of Europe, like Balkanian countries, and some African countries, right? So
yes.
But the number one, I would say that United Kingdom, right?
It is.
Perfect. And I think the support that you've just been describing is so essential, because patients are feeling so lost when trying to understand what they need to do next. So having that team speaking in different languages and just being on the other side of an email or a mobile phone, it's so valuable for them. And I think that's a big advantage that patients don't get with local clinics that might just be around the corner or across the street, but they're not always open or available to answer questions and support.
Absolutely right.
And also at the moment we have a representative in Birmingham and in London, and so and they are able to see our team members face to face, which is just like very nice thing for the patients. And then also they can just reach us via phone all the time, and our Turkey team as well, the UK team. And then also after they come back, we follow up too. And then, we are sending for some blood tests for their pregnancy tests or the others like AMH today. And so we are trying to build our system as much as we can, every day improving.
Yeah.
Right.
And I think it's just the future, because more and more people will be needing fertility treatment, and crossing the border is just going to be even easier as time goes by. So having these options and improving accessibility is so important. And I wanted to thank you for being part of the solution, because without that support, many people would not be able to have their families.
Right. Correct. So in the near future, I believe that the number of people seeking treatment abroad will be increased because of the cost in some countries, and accessibility. So friendly approach and being on the scientific side are the most important values in one center. So we act or we treat our patients according to the recent developments and according to the scientific truth, rather than just applying treatments. So these are valuable, things to provide medical services, I believe.
He always explain all the scientific details to patients and as much as he can. And it's very nice. I mean, it's not easy. He's like a tutor for the patients as well. And they will be understand better when he explains in a scientific way. Also, just going to Turkey, majority of the UK people who's living in the UK, they are British. And then for the British citizen, we don't have a visa issue. They can directly fly next day when they want to fly. Turkey doesn't require visa. So for the UK citizen, mostly the other countries as well. So which is another good thing for the people who wants to go to Turkey from the UK.
And I think we were mentioning earlier, is there an age limit, or can we treat also single and married couples, or restrictions around weight? Some of the things that we hear about in the UK, are those restrictions there, or?
In terms of age, no, we don't have restriction. However, pregnancy rate drops significantly after the age of 43. So we do not advise our patients to try IVF over 46, 45 because of pregnancy rate being so limited. In terms of body weight, no, we do not have restriction. But again, morbid obesity is a severe factor that impacts pregnancy rate significantly. So sometimes we collect patients, or we just advise our patients to lose weight before trying IVF, before going through IVF cycles. But in terms of law, in terms of state law, there is no limitation, but there is limitation or restriction in terms of pregnancy rate or biological factors. The third question is related to egg donation or sperm donation. No, we do not do this procedures in Turkey.
In Turkey, you are not able to do that.
I think there's a question here about gender selection. No. I'm not sure.
No, this service is not available in Turkey, unfortunately. Not.
Yeah, it's a very limited service. I know it's not common, at least more common in the US.
Yeah, it is, but it's not provided in Turkey.
Yeah, and someone is asking about the protocol for people with endometriosis.
Actually, there are some studies comparing the long protocol and short protocol in patients with endometriosis, endometrioma. And none of them has been found to be superior to other ones. So since short protocol seems much more practical in patients coming from abroad, we apply short protocol in patients with endometriosis. So we don't use long protocol or ultra long protocol.
Yeah, but they can always reach us to send their report and the results to see their level of endometriosis, and doctor can evaluate it individually because everybody has a different situation, so we can advise them better.
You mentioned laparoscopy earlier. So if a patient with endometriosis needs surgery to remove bits of endometriosis, is that something that they could get as well before IVF?
Yeah, they could get this operation in Turkey, but it's a very debatable, hot topic whether or not doing surgery, performing surgery in patients with endometrioma or endometriosis. If the cyst is too large, obscuring the view of a physician during the egg retrieval procedure, we opt to remove this the cyst before the IVF procedure. But otherwise, we don't opt to carry out operations in patients with endometrioma measuring less than 3 centimeters. So it needs to be decided individually. So if they send us their full data, full report, then we can discuss on the next step. But we try to avoid surgery in patients with endometrioma, since the operation itself might decrease the number of eggs located in the ovary itself.
Yeah, that makes sense.
Hopefully we'll be doing some other Instagram live for some other topics and medical topics with the doctor, and for other potential patients, they can ask their questions.
Absolutely.
I'll be glad to do that. I'll be glad to do that.
I think that's a great idea, and we can just do a whole one on endometriosis as well. That would be a great idea as well.
Sure, I'll be happy to do that.
And I think the next topic we have next month is all about ovarian rejuvenation.
Okay. Okay.
I am looking forward to that one, because we get so many questions about it.
Sure.
And people really struggle to find places where they can have that. And you know, it's almost like the last door they can try to open.
Right.
So I think it's a really important topic to talk about, and talk about the science behind it. And so I'm really looking forward to our next Insta Live already.
Okay, I'll be delighted to talk about the ovarian rejuvenation next month.
And Zuhal, one last tip for everyone who is listening, who maybe would like to get in touch with IVF Turkey. How can they get in touch with you?
Then now we are on Instagram Live, and so they can follow us and directly the messages on Instagram, or they can visit our website ivfturkey.com, and they can also email us, and maybe you can just put the information in the end.
Yeah.
And we are going to share this Instagram Live on our page, and then if you'll be also sharing that, there will be some kind of reaching information, and we will be grateful to help them.
Perfect. That sounds amazing. Thank you so much, Zuhal. Thank you, Professor Karacan.
Well, it was wonderful to be with you. So we also like to see you in Turkey one day.
Absolutely.
Okay.
Bye.
Thank you.